The Wuhan Coronavirus. Everything you need to know about the coronavirus outbreak. The Wuhan coronavirus has killed 492 people and infected more than 23,000. The death toll of a coronavirus outbreak sweeping China has reached at least 492, with more than 23,000 people infected as of Tuesday morning. Here's everything we know about the outbreak. The virus has spread to at least 25 other countries. At least 2 deaths have been reported outside China, one in Hong Kong and another in the Philippines. Chinese authorities quarantined the city of Wuhan and many other cities with all transportation halted. A man in the Philippines became the first person to die of the virus outside of mainland China on Saturday, followed by a 39-year-old man in Hong Kong on Tuesday. The virus has spread to every province and region in China, as well as at least 25 other countries. The death toll and number of infected patients in mainland China has exceeded that of the 2003 SARS outbreak there, though the total SARS death toll remains higher. The virus might have jumped from animals to people at a market in the city of Wuhan. Outside of China, cases have been reported in Australia, Belgium, Cambodia, Canada, Finland, France, Germany, India, Italy, Japan, Malaysia, Nepal, the Philippines, Russia, Singapore, South Korea, Spain, Sri Lanka, Sweden, Taiwan, Thailand, the United Arab Emirates, the UK, the US, and Vietnam. The US has reported 11 cases so far: 6 people in California, a husband and wife in Chicago, Illinois, a man in his 30s in Washington state, 1 patient in Arizona, and 1 in Massachusetts. The first case of the coronavirus was reported in Wuhan in December. The central Chinese city has a population of 11 million. The virus pneumonia-like symptoms include fever and difficulty breathing. According to the Centers for Disease Control and Prevention (CDC), a person could be at risk if they have fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing, after traveling to Wuhan or having close contact with someone who was ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who's been confirmed to have the virus. Chinese health officials say the incubation period for the virus ranges from 1 to 14 days, during which time carriers can be infectious. Most patients who died were elderly or otherwise unwell, according to Chinese officials, but one victim was a 36-year-old man. The global spread of the Wuhan coronavirus. Total deaths, 427 confirmed cases, 20,740 countries impacted, 25 people quarantined, 45 million. Last week, the World Health Organization (WHO) declared the coronavirus outbreak a global public health emergency. The Trump administration has imposed a travel ban on foreign nationals who have been in China within the last 14 days. The ban went into effect on February 2, with exceptions made for immediate family of American citizens and permanent residents. U.S. citizens returning home who have been in China's Hubei province within the prior 14 days may be quarantined for up to 2 weeks. The American public can be assured the full weight of the U.S. government is working to safeguard the health and safety of the American people, Health and Human Services Secretary Alex Azar said last week. Here's the latest on the virus and how the world is trying to stop it. The coronavirus family, the viruses in this large group typically affect the respiratory tract. This particular one, known as 2019 nCoV, had never been seen in humans before. Symptoms: patients have reported symptoms similar to those associated with pneumonia, such as fever, coughing, chills, headache, difficulty breathing, and a sore throat. How it spreads: the virus can be transmitted between people through respiratory droplets such as saliva or mucus. It may be passed before a person shows symptoms. The coronavirus name: all viruses in the family have an external structure that features little crown-like spikes. In Latin, corona means crown. Other coronaviruses cause SARS, MERS, and pneumonia. Where it came from, many researchers think the coronavirus jumped from animals to people at the Wuhan wholesale seafood market. The market closed down on January 1. A group of scientists initially initially suggested that the virus might have hopped from bats to snakes then to humans, but more recent studies suggest that it likely spread from bats to a mammal, potentially pigs or civets, before jumping to people. A direct hop from bats is also possible. Johns Hopkins doctor says new coronavirus is here to stay. Expects seasonal outbreaks. Johns Hopkins senior scholar Dr. Umesh Adalja said the new coronavirus will likely cause yearly outbreaks, with most of the cases being mild. Many people are going to get mild illness and it's going to be more like a flu-like illness for many people, but for some it may be very severe, he said. Adalja compared the new coronavirus to the H1N1 swine flu outbreak that hit in 2009.